Hello, everyone, and welcome to Public Health News Network. So, I'm Thomas, and today we're going to investigate how health surveillance systems operate on the front lines of global health emergencies. So, focusing on the critical role surveillance played during the devastating 2014 and 2016 Ebola virus epidemic in West Africa, when an emerging pathogen strikes, surveillance is the eyes and ears of public health. Without it, basically containment is impossible. Now, to understand this response, we must first examine the four core types of surveillance. The first one is passive surveillance. It relies on clinics routinely reporting disease data to authorities, and then we can find the active one, which basically it involves public health staff actively going into communities to find cases, and then syndromic, which monitors real-time symptom clusters like sudden fever or unexplained bleeding before laboratory confirmation. And then the last one, the sentinel surveillance, it uses designated high-risk health facilities to spot early trends. So, in the West Africa Ebola outbreak, response teams integrated all four types, but relied heavily on active contact tracing and syndromic tracking in order, well, to locate the hidden transmissions chains in, like, for example, remote villages. Now, key indicators. So during the outbreak, epidemiologists continuously track primary indicators such as fatality rate, daily incidence rates, and contact follow-up percentages. So basically, these metrics were essential for evaluating virus severity and identifying geographic hotspots. However, surveillance teams faced immense challenges, including delayed laboratory diagnostic times, severe underreporting due to community fear and social stigma, and also weak local health infrastructure, which initially allowed the virus to spread undetected across national borders. Now, risk control strategies. So, surveillance data directly dictated public health action and risk control strategies. Real-time data highlighting high transmissions in traditional burial practices led directly to deploying specialized safe burial teams. Furthermore, mapping contact clusters allow authorities to implement target quarantines, establish border screening points, and well, also they allocate limited international medical resources and personal protective equipment directly to the highest risk regions. And in summary, the Ebola outbreak demonstrated that rapid multi tired civilians in is basically like the cornerstone of global health security. From early syndromic alerts to active field contact tracing, so data remains our most powerful weapon against infections threats. Thank you so much for turning into the Public Health News Network. Have a great journey.